public health expert and adjunct professor at New York University, Nana Kofi Quakyi, on his part, called on political actors on both sides to have a serious conversation about the subject, else there would be a serious public health crisis after the elections.
Very serious conversation about that. I don't think we can continue what we are seeing, even if we just go by the active case and say that that is our official record. What we are seeing there and that kind of rapid escalation should cause some pause. We can't say we're doing tours that are actually rallies just because you're in a car doesn't make it not a problem, because the people on the road, like Dr. Podo was saying, are not wearing masks, they're not doing that. So there has to be some serious conversation. I think political actors on both sides have to find time and really look at what the situation is here, because the reality is if we continue at this rate, whoever is president on January 7th is going to have a serious public health crisis to deal with.
Global health public health expert Dr. John Amoisi has also been contributing to the discussion.
No, you're absolutely right. You see, you need to take these things in context. If you look at it in terms of the ultimate outcome, which is death, you would not be too worried presently because of the relatively lower death rates. This is the point I was trying to make.
Okay.
Now you can look at it at various levels, including simply the morbidity that comes along with infections. Because there are some diseases, and COVID maybe to some degree, where you're least concerned about the death, but more concerned about having the illness itself. Because having the illness takes you away from work, makes you less productive, and ultimately does not bode well for the economy. So all these things are really in different perspectives. And I'm saying, looking at it from the perspective of risk of death, I would say that not too bad presently, but if we certainly continue at this rate, we will have trouble moving up. And this is where to answer your definitive answer to your question around political activity, especially coming up with the elections. Naturally, with elections, there will be increased levels of contact, increased levels of association. There will invariably be spread.
Doc, I'm really sorry, but we have to go. Would that be a yes or no on capping political activity?
No, I certainly could not say yes or no to that. It's not political activity, but certainly restricting the gathering and the movement of people to some degree would be the way to go. And this doesn't have to be into the political sphere.